Welcome to Dr. Balga's podcast for the Curious Doc. Today is 14 Jan 2026. This video is on a Science Immunology article published on 2nd January 2026 titled DNA Damaging Chemotherapy Reshapes Cardiac Resident Macrophage Composition and Function. Some DNA damaging chemotherapies increase later cardiovascular disease risk. Whether they reprogram the cardiac resident immune compartment is unclear. The study system comprised of a mouse model with a focus on carboplatin, a DNA cross-linking platinum agent with comparison to other DNA damaging drugs, young adult mice 8 weeks old, both genders as applicable per experiment. Cardiac macrophages were stratified by CCR2, that is chemokine receptor type 2 expression. The sample size in hypertensive injury experiments 5 to 6 per group for fibrosis and cardiomyocyte area quantification. Follow-up: carboplatin or phosphate buffered saline exposure followed by 4-week recovery. Downstream injury models included 28-day angiotensin II phenylephrine infusion and ischemia reperfusion with echo for 4 weeks after injury. Methods utilized: flow cytometry, histology, trichrome, bead germ agglutinin, RT-PCR, and transcriptional profiling, RNA-seq, single-cell RNA-seq, to define depletion and repopulation programs. Statistics included two-way ANOVA with SIDAC multiple comparisons for multi-group analysis. Data reported as mean or plus or minus standard error of mean. What did they find? Remodeling after injury. Prior carboplatin exposure attenuated ventricular remodeling after angiotensin II phenylephrine stress. Fibrosis area was reduced. P-value was for key contrast 0.0021 and 0.0001. Sham comparison, p-value is not significant. Myocyte hypertrophy. Cardiomyocyte cross-section area was smaller with prior carboplatin in the angiotensin II phenylephrine model compared to sham. Gene expression. Hypertrophy and remodeling markers at day 7 were lower after carboplatin, angiotensin II, and phenylephrine. Natriuretic peptide A and B were affected, p-value 0.0001. Periostin was also affected, p-value equals 0.0001. Mechanistic frame. Carboplatin causes preferential loss and repopulation of chemokine receptor 2 negative cardiac resident macrophages, producing a resident-like compartment that blunts remodeling in later injury models. Limitation of the study: mouse data. Carboplatin-centric dosing and controlled injury models may not reflect combination regimens, tumor-bearing hosts, or long-term human outcomes. Key takeaways: DNA-damaging chemo can rewire cardiac resident macrophages. The post-chemo macrophage landscape may meaningfully alter subsequent cardiac injury responses. This is an underappreciated axis for cardio-oncology risk stratification. Clinical pearls: think immune remodeling. Cardiotoxins are not purely cardiac myocyte intrinsic. Chemotherapy can shift the cardiac immune baseline that shapes later healing. For example, after adriamycin, sometimes we see cardiotoxicity years after or decades after initial therapy. Timing matters. A 4-week recovery window still leaves a biologically altered macrophage compartment. Consider that survivorship risk is dynamic, not static. Translational hypotheses: if similar shifts occur in human phenotyping, blood surrogates or imaging might help personalize surveillance intensity after DNA damaging regimens. Trial design tip: in cardioprotection trials, stratify by prior DNA damaging exposure and time since therapy. Macrophage state could be an effect modifier. These are few eponyms related to this article. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.